afternoon, everyone. This is Senior Talk with Clara Hubbard, and we're here live at the beautiful Oak Street Health in Englewood. They are doing good in the hood at 850 West 63rd Street. It is National Diabetes Awareness Month, and we know our friends at Oak Street Health, they believe in the community getting the best quality of knowledge, and that's why we're here. Today, our special guest is none other than AD Medical Supply, also known as AmericasDietitians.com. They're our special guest here. Stay tuned for more great programming. And when this video is over, please go to Senior Talk TV on YouTube. We'll be glad to serve you. Talk with you real soon. Good afternoon, family. Once again, this is Senior Talk with Clara Hubbard, and we're here live at Oak Street Health in Englewood. The beautiful city of Englewood is almost a community in itself here in the beautiful city of Chicago. We're here live because it is National Diabetes Awareness Month, and we have our preferred professional, my brother Corey is here today. He is proprietor and president of AD Medical, which is also known as American Dietitians. So we're going to talk everything diabetes, talk about the business, the great work he has done. And even though he looks real young, he has an experience background that is really going to be awesome to you. So before we go any further, we must thank our host, our great friends again of Oak Street Health right here in the city of Englewood of Chicago, because Chicago has a lot of neighborhoods, but Englewood is rocking and rolling, and we're glad that they welcomed us here today. We do have a lot of special guests too, clients and patients of Oak Street Health who decide to come on out and be a part of our show, and you'll hear from them later. So we finally got together, me and Corey. Welcome, 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 Corey. How are you today?
I'm doing great. Thank you very much.
Fantastic. So Corey is the proprietor of American Dietitians, which is also known as AD Medical. And what does that mean, Corey? Tell us what that means.
Well, America's Dietitians is a organization that's built upon managing the disease of diabetes. So we started this 16 years ago here in Chicago, going into the homes of people who are diagnosed as diabetic, teaching them about the lifestyle, how to manage the disease, how to understand the lifestyle choices that they're making, all in the comfort of their own homes. So thank you for having me today. It's really awesome. This is November is Diabetes Awareness Month, and actually tomorrow, November 14th, is the Diabetes Awareness Day proper. So we're excited to be able to talk more about our programs and what we can do for not only the Englewood community, but for those around Chicago and across the country.
Well, one of the key titles that you have that I really like about visiting your website is that wellness is knowledge. Tell us how that's defined through the work that you do with AD Medical.
Correct. Yeah, wellness is a concept that is heavily discussed within the medical community these days. It's we believe wellness is knowledge, wellness is pain-free, wellness is support. It's a broader piece of it, but the knowledge component of it really dives into the core of our business, and that is having registered dietitians inside the homes of people who are diabetic. We do what's called nutrition therapy. So just like other therapies that people may be aware of, physical therapy or occupational therapy, we do nutrition therapy to be one-on-one in these patients' homes, teaching them about carb counting, calorie counting, portion control, food label reading, and the topics and discussions that we need to have to really understand how to manage that disease about it. So the knowledge of it is understanding the lifestyle choices that they're making and making sure that whether it's a right decision or a wrong decision, at least you know what that decision is and how it can affect you.
So what you're talking about specifically is a beautiful title here, medical nutrition therapy. So this is something where your clients will have an in-home consultation, and then you'll put a plan of care together for them. How does that work?
Correct. Well, what most people don't understand or wouldn't know is that not only Medicare, but many of our health insurance policies have created this nutrition therapy as being one of the few preventative programs in this country.
Preventative.
Preventative.
Hello.
Exactly.
Yes.
Meaning that if you understand the disease and you can manage the disease, we can prevent the other complications and the comorbidities that are involved with the disease. So the nutrition therapy is paid for as a initial assessment, as an encounter. We want to sit down one-on-one with the patient, find out how compliant they are within the disease. Do they understand the lifestyle choices that they're making or the complications that can happen? And then we're going to create a plan of care for that patient on the ongoing.
Right.
So whether that is seeing them 30 minutes of recorder, just reminding them about these choices, or we need to see them more often, we're putting a plan of care together for these individuals, and then reporting that information back to the rest of the healthcare team, right? So we want to work with the primary care physicians, we want to work with the nursing staff or the other therapists that are involved to give them, here's our report, here's the assessment as to what's happened, here's the expected outcomes of what's going to happen,
Yes.
and we want you to help us drive this message so that we're all one big healthcare component.
So you have a team of how many people?
I've got now 36 dietitians across 16 states.
16 states. So we got a lot of ground to cover.
It's been great because it's we started here in Chicago with about 5 dietitians 16 years ago, and as we continued to drive this message and understand the preventative side to all of these other agencies and patients and clients in their homes, it started to become self-reference to say, hey, you guys should come to Indianapolis with us, right? We think there's other people that could do that. And as an entrepreneur and a go-getter, I drove to Indianapolis to try to get that going. We've gone to Detroit, we've gone to St. Louis, we've gone to a lot of the metro markets throughout, so we're excited to have about 36 dietitians right now on the team.
And I think you're expressing something very important. This is a new wave of healthcare. You have to go to the clients. That's why our program, we come to you. We want to know who we're touching and we're reaching. So the in-home consultation allows you to see the environment of the client, and it also builds a rapport and a trust factor. So tell us about the safety value that you really use with AD Medical.
Yeah, you know, when a physician diagnoses a patient with diabetes, or you're going to an outpatient clinic to help manage that disease, those are all great and awesome components that these patients need to have. All we're trying to do is add on a service to it by being in the comfort of their own home, right? If you're going to an outpatient class of, let's say, maybe 10 other individuals, you're learning more of a broad spectrum as to how to manage that disease and what could work. But that doesn't mean it's going to happen or that it's focused for me specific or for you specific.
Right, right.
So being in the comfort of their own home, going through their cabinets, going through their fridge or their freezer, getting to understand what their lifestyle is.
Wait, hold on. You said cabinets. Are people going to let you? You know, we're so like, you know how we are.
Sure.
So you're going to go through my cabinets and give me advice on what I have in my refrigerator?
We're going to do what you allow us to do.
Okay,
of course,
right. I know,
But
I'm just saying.
in order to really help them manage and to fully understand it,
Sure.
we need to understand what their lifestyle entails. Is it a lot of canned fruits and vegetables versus fresh fruits and vegetables? Is it processed versus boxed foods? Okay, we want an understanding better as to what their lifestyle entails. And
Okay.
we can create better plans and course of action if we know that.
So here's a dynamic that we have to consider. You're covering, your insurance providers are either Medicare or Medicaid patients, correct?
Correct.
Okay, but everyone does not have what we have in Englewood. In a lot of places, there are disparities of food and fresh fruits and vegetables.
Right.
So what can you offer, or what is your alternative to that in putting a plan of care together?
Yeah, we have several different types of resources that we provide to the patient based upon whether it's income, whether it's society, whether it's ethnic backgrounds. We want to come in to show, okay, if these are the choices you have, here's a choice that may be better than the other.
Okay.
If it's simply from going from white bread to wheat bread or something, it's just to help you to understand by reading those food labels that even if you only have so many choices, there's some choices that are better than the others.
Okay. Now, what are the testimonies? If you're coming in, because I know, being in this industry for the short 8 years that I have been in this industry, most people heal better at home because they're in their own environment. What are your thoughts on that? And what are the testimonies? Because you have to have testimonies.
Absolutely. And the biggest testimonies is not only from the individual, but the caregiver and the rest of the family, because we want them to be involved in this as well. This isn't
Great
when
statement.
we say it's one-on-one within their homes. It's because that's what the actual course of the billing, right, would
Sure.
be. But no, we want the mom, we want dad, we want brother, we want sister, we want caregiver, we want friends, we want whomever that's there to help them support that lifestyle, so that maybe they're going to help make those changes, whether it's food preparation. Maybe they're not the ones who are the cook in the house. Maybe we can educate the rest of the people inside as to carb counting techniques so that they can help make those changes as well. It's not one-on-one, which is where we talk about how our interaction goes with the rest of the healthcare team as
Sure.
well, and reporting that back, because we can give recommendations, we can tell people what to do, but whether they do it, that's up to them.
That's a big one. That's a big one. So what we're going to do is we're going to take a quick pause for the cause. And there are some great people here who are part of our studio audience. We're going to bring them up with a question or two. Everyone stay tuned. We'll be right back here on Senior Talk TV on YouTube.
I'm so excited to have you here at Oak Street. My name is Deborah Payne, and I do senior exercise for seniors here on Tuesday. I listened to your platform, and I am so graciously thankful that there's someone out here in the industry that will help educate people with diabetes. A lot of times people call it my sugar. I have sugar,
Right.
and I can't eat candy, and they take a lot of myths. But what you have to offer is education, and that is so important. Our people perish by a lack of knowledge, and it is important because diabetes in our community is on the rage. What I would like to ask you, hopingly that you say yes. On Tuesdays, I teach a class here, and I have a few people in my class that do have diabetes, and they talk about it, and maybe you and your team might come out and just have a little conversation with them and bring them up to speed, talk about the Lancets and all the things that go with it.
Right. Well, thank you for that nice compliment. I appreciate that. Community outreach is a big part of what we do, right? We want to not only be in their homes, but if we can be in the environment such as Oak Street Health, where it has such a great community environment to it, we want to come out there and educate as many people as possible. If it's maybe on a broader spectrum, that's fine. And the activity component that you're doing is fantastic. One of the things that I do, and you kind of alluded to it, is I do, outside of just the education, we're able to do other products to help these patients manage their diabetes. And oftentimes when people have diabetes, their circulation is compromised. We want to take care of their feet and the other areas of their body that have that compromised circulation. We're able to provide products such as diabetic shoes to these individuals, try to get them to be more active. We want them to be in these community environments to be able to do yoga, to be able to do different activities with their friends, or hopefully their soon-to-be friends.
Right.
So we're always willing to come out and present on an education piece, and make sure that we're as much as a part of the environment as you'll allow us to be.
Oh,
Yes.
well, I definitely welcome you here. In fact, after this, I will make sure I can put you on our calendar. Another thing I would like to say, a lot of people are into talking about CBD oil and all of that, and this is being a big outburst over the media, the radio and stuff. They have rubs and all of that.
Sure.
Some people just go and readily buy that stuff without really having knowledge of it, and that's why it's good. And I'd like to have you here to even talk about that instance, because there's no instant cure. It's a lifestyle.
Correct.
And my thing is, you're not dying from diabetes. You're living with diabetes. And it is impossible to be a cured diabetic.
It is definitely a lifestyle decision, lifestyle choice. You're right. We're not dying of diabetes, but you die of the complications and the
Right.
comorbidities that are involved with it, which is unfortunate, all said and done either way, right? When it comes to alternative products, being CBDs, lotions, oils, anything like that, we're going to always default for them to speak to their primary care physician about that prior to doing any of that, especially when you have sensitivities with a diabetic. Most of the time with neuropathy, the pain, the tingling, the numbness that they can experience in their extremities, it's very critical that they understand what they're using so that they're not making a condition worse. So we like to educate them as much as possible about that and how to make sure that they're continuing to keep the rest of the healthcare team part of that plan of action. So, yes.
I'm so excited to have
Well, thank you for
here,
having
and
me.
I
I
am
appreciate
really
it.
looking forward. I'm going to check my calendar, and we're going to have Corey on that.
Thank you so much.
Thank you so much.
All right, everyone, we are back here on Senior Talk TV on YouTube. Thank you to Miss Deborah for her phenomenal co-hosting and asking questions. And Corey, get yourself ready.
Yes.
Because she is boots on the ground.
We're ready.
You're going to be
We're
busy.
ready.
You're going to be busy. So everyone, let me say it's been a pleasure to be here today. Don't forget that we can bring services to you. Senior Talk with Clara Hubbard is 100% directly to you. Our services are at no cost. We do need an invitation. Corey got an invitation today. He has on nice shoes today. He'll be on roller skates starting next week, I tell you, because Miss Deborah is not playing with him. So everyone, we are here at the beautiful Oak Street Health location in the city of Englewood that is doing good in the hood. And we want you to remember that Senior Talk is here to serve you. So Corey, give us your closing remarks. We need all of your communication, social media, Facebook, website, all that great stuff.
Yeah, absolutely. America's Dietitians, we've been in the community for 16 years now. We're excited to continue to build our reputation throughout the not only the state of Illinois, but throughout the rest of the country. We can be reached at 773-292-1940. Our website is admedicalinc.com. That's Apple David Medicalinc.com. You can see us on our social media, on Facebook, on Twitter, on Instagram, all of those other great
And
things.
soon on Senior Talk TV on YouTube. And also the website, if you can remember, is American Dietitians. America's Dietitians.com. So everyone, as we always say, first of all, thank you, Corey, for your time, attention, and your partnership. We got a lot of ground to cover. And everyone, please remember, in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. We will see you next time. We hope our program has been a blessing to you, and we look forward to serving you soon. Everyone, take care and have a great day.